We continue to hear from veterans who say they're still seeing delays, navigating seemingly endless red tape, and dealing with countless referrals. Now, a recently retired doctor who's also a former soldier is speaking exclusively to me about what he calls broken promises.
Delayed access of care and limited access of care is a violation of the promise they made to us.
Dr. Dan Goff has taken his concerns about the Southern Nevada VA all the way up to the Inspector General. His chief complaint is what he saw as routine transferring of veterans into the community for care they should have gotten in the VA.
When they put that rifle in your hand and said, go face the enemy, you didn't say, well, let me transfer the enemy somewhere else. You went out and you held that rifle. The promise was, for doing that, we will take care of you. Well, they're not doing it, and why not?
Goff himself is a veteran with 13 years active duty. An Army-trained physician, he was one of 3 doctors who opened the emergency department at the VA hospital in North Las Vegas. Before that, he'd been ER director in 4 hospitals and chief of staff at 1. He says the VA should be providing the best care anywhere, but he didn't see that in his 5 years with the VA because patients were sent elsewhere for the best available care.
Transfer the patient. That became the mantra. Transfer the patient.
That is not routine.
VA Emergency Department Director Dr. Mariana Coggins.
Most of our veterans who require transfer, at times it's for higher level of care, or at times when we don't have beds available within our facility.
Why do we have to transfer somebody for a GI problem? Why do we have to transfer somebody for a urology problem on the weekend?
Is there an issue with weekends versus weekday staffing?
It depends.
What depends on what?
It depends on the service. Some of these specialty services may have very limited staff.
Dr. Coggins says the Southern Nevada VA's emergency department had 38,000 visits last year and is the 5th busiest in the country. Goff thinks that's because it's overloaded with patients who can't get care at other VA facilities.
I had a patient come to the hospital that had a 1-inch laceration on the hand. 1 inch. Why are you here? I went to my clinic. They told me they don't do lacerations.
Coggins says any vet is welcome in the ER for any reason.
As an emergency department physician, I never think someone does not belong here. If they're presenting here, they're presenting for care, and it's my job to provide it.
When the VA first opened, they only had 3 emergency doctors on staff, but since the expansion, it's now literally 5 times that. And while that has significantly helped cut down on delays in care, there are still some needs. For example, they don't take ambulances, and there's a shortage of specialists.
The availability of specialty care is not solely a VA issue. This is a challenge that we face within our state.
And what's the VA doing to bridge that gap?
We try to really increase our recruitment efforts. It's very competitive, many specialties, including emergency medicine physicians.
For Goff, it all comes back to one thing.
This is the VA. Where's that promise?
The VA Emergency Department has recently implemented a virtual bed program so they can care for and admit more veterans within their facility to reduce transfers into the community. Darcy Spears, 13 Action News.